So, hello everyone, welcome to Anima Anatomia. I am Durgesh Jaglan, and in today's video, we will be discussing the joints of upper limb. So, let's start with our first joint, which is the shoulder joint. So, this shoulder joint is between the scapula and humerus, two bones from scapula bone and humerus bone. So, it is a type of ball and socket joint. Okay, so let's see the joint and let's see the ligaments involved. So, this is the whole shoulder joint, which is made between scapula and humerus. There are three main types of ligament involved. The first one is coracoacromial ligament, which is in yellow color. The second one is coracohumeral ligament, which is of this red color. And third one is glenohumeral ligament, which is blue in color. You can see and you can understand from this picture. Next, there are two movements involved in this joint. First is flexion and extension, and second one is abduction and adduction. So let's see. So this is the shoulder joint. So first of all is the extension, in which the angle between the humerus and acromion of the scapula is increasing. The angle is increasing. This is the whole angle. Just wait. This angle is increasing, so it's extension. And in flexion, the angle between humerus and acromion of scapula is decreasing, so it's extension and flexion. The next movement is abduction and adduction. The movement which is towards the body is adduction. You can remember from this word like adduction, add, we are adding to the body. Abduction, away from the body, away to, away the body and to the body. Next joint, elbow joint. So elbow joint is made between the humerus and radius plus ulna, but mainly the ulna is the star in this particular joint. So it is a type of hinge joint. Let's see the joint. So it's the radio or the this humero ulnar joint, or we can say the elbow joint. Okay, so this is the main elbow joint. In this, first of all, is this joint capsule, which is green in color. Second is the annular ligament, which is marked as the blue in color. Next is the ulnar collateral ligament, which is red, and you can see this through the medial side. Remember, you can see this ulnar ligament from the medial side and the radial collateral ligament from the lateral side, because they are present at their specific positions. So next, there is this one movement, which is the flexion and extension. So this is the flexion and extension. Remember, in extension, the angle increases, and in flexion, the angle decreases. So here there is this elbow extension where the joint angle is large, nearly 180 degree, and here the angle is small. So it's flexion and extension. So now we are moving forward to the next one, joint. So it is the radio-ulnar joint, which is of two types, which is radio-ulnar proximal and distal. So you can say the distal radio-ulnar joint and the proximal radio-ulnar joint made between the radius and ulna. So now you can see this, there is this radio-ulnar joint, which is formed, there is between the radius and ulna, there are two parts. the proximal radioulnar joint, which is situated proximally, and the distal radioulnar joint situated distally. There are two types of movement in this particular joint, which are pronation and supination. So pronation is rotating in and down. The in and down movement is known as pronation, and supination is rotating out and up. So the up and out movement is known as supination. So it is a type of, you can see the type also, I can write here. So it is a type of, it's a type of pivot joint. So now we will move forward to the wrist joint. So it is made between radius, ulna, and the carpal bones. It is a type of plane joint, and we can see the joint. So it's the wrist joint. This is the ulna, this is the radius. Okay, so ulna, radius, and this is the wrist joint, and these are the carpal bones, the proximal carpal. These are the proximal carpal bones. So now we can see the movement. So there are two types of movements. First of all is this adduction, and second one is this abduction. So similarly, when we place our hand in the anatomical position, so the movement which is towards the body is adduction, and the movement which is away the body is abduction. The next movement is this flexion and extension. So the closing of joint anteriorly is flexion, and the opening the joint anteriorly is extension. So flexion is the closing of joint, and the extension is the opening of joint. You can see from this picture. So now we come forward to the metacarpal phalangeal joint. So it is formed between the metacarpal and phalanges. So it is a type of condyloid joint. So you can see between the metacarpal and phalanges. It is the metacarpophalangeal joint. There are two types of movement involved in this. First is flexion and extension, and second one is abduction and adduction. So abduction. So abduction is the movement away from the body, away from the center. So here we are seeing the central part. Okay. So take this as a center. So away, the movement away. These are, so it's abduction, and adduction towards is adduction. The next one is this extension and flexion. So here, this is the flexion, the downward movement, and the upward movement is extension. And there is one more movement which is this. This is a hyper extension, where the angle is more than the particular slanting position. So it is known as the hyper extension. The next and the last joint of the upper limb is interphalangeal joint.